Good evening. My name is Dr. Reed Tuckson. I am the co-founder of the Black Coalition Against COVID and a frequent collaborator with blackdoctor.org. We are so pleased to offer you this program, which we have entitled Family First, Adult Vaccines for Every Age. You are here because you care about your health and you care about protecting yourself from vaccine-preventable diseases, which of course is one of the best ways to keep yourself healthy and to bring your best health to optimally serving the needs of your family and your community. You're here because not only do you care about your health, but also because you are a thoughtful person who seeks out trustworthy information and expert guidance upon which to make personally appropriate health choices and decisions. And so we thank you for joining us. Thank you for caring enough to look for facts and trustworthy information. This program tonight will explore three critical issues: what we need to understand about the new bivalent COVID vaccine, which is so very important, what we need to know about the pneumonia vaccine, and of course, we'll mention the flu vaccine as well. And then third, what we need to know about the shingles vaccine, which for adults, as we will see later, is something very important to be aware of. Well, to discuss all of this in a relevant and understandable and actionable manner, I'm pleased to welcome four outstanding experts who will engage these topics from different perspectives. Dr. Keith Crawford, a program officer in drug development in the clinical sciences branch division of AIDS at the National Institute of Health. Eric Griggs, a physician, assistant vice president of community affairs at Access Health Louisiana. Dr. Griggs also serves as an adjunct assistant professor at the Tulane School of Public Health and Tropical Medicine. He also serves that same capacity at the LSU School of Medicine and the Xavier University College of Pharmacy. Dr. LaShawn McIver, a good friend of mine and of the program, director of the Office of Minority Health at the Centers for Medicare and Medicaid Services. Prior to that work, she served as the senior vice president of government affairs and advocacy at the American Diabetes Association. Margaret Meg Frazier, MD, senior director, team leader, Vaccines Field Medical at Pfizer Pharmaceutical Medical Affairs. And she's also a practicing neurologist. And finally, Charlie John, a doctor of pharmacy, who is director of healthcare strategy for the Walgreen Company. His work primarily involves engaging with public officials and industry and community leaders around healthcare policy in efforts to improve both the administration and the outcomes of our healthcare system. Well, to make best use of our expert panel and to meet your needs, we encourage you to put your questions in the chat, and we will get to as many of them as possible during and before the end of the show. Well, let's start off with this extremely timely and welcome news about the new bivalent vaccine. Dr. McIver, can you help set the context about what's going on with COVID and the variants, the cases, vaccination rates, hospital rates? What's happening? Because one thing I know for sure as I ask you this question, COVID ain't over. What's going on?
Well, thank you for that question. And I'll start by saying good evening to everyone. I'm really glad to have the opportunity to come and share with you some exciting information about what's happening at CMS, but more importantly, to talk about these important issues today. So when we think about the latest information relating to COVID, the CDC keeps track of data and provides updates weekly on this. And right now, most of the country is in low or medium community levels. As of September 29th, 2022, there are 107 counties, or 3.3% of counties, districts, or territories with high COVID-19 community levels. 737 or 22% of counties that are designated with medium community level, and 2,373 or 73.7% of counties have low community level. So in terms of the current state, that's some information from the CDC. Now, the CDC now casts projections for the week ending in October 1st, estimate that the combined national proportion of lineage designated as Omicron will continue to be 100%. And there are 5 sublineages designated as Omicron, and much of these same Omicron variants we have been hearing about, and the ones the updated vaccines were made specifically to address. So, we are here tonight to talk about vaccines and why vaccines are important. The CDC recommended the updated COVID-19 boosters earlier this month, and we know that 7.9 million eligible in the United States have gotten one. And I'll just end by saying that means across the US, 67.7% of people have completed their primary series, and you'll see even higher numbers in many of the US territories. So in terms of the current state, that's some information to get us started, but we are still encouraging people to get their COVID-19 vaccine because, as you said, COVID is not over, and we are still, working through this day by day.
Well, thank you for that. And I think that the one thing that I really want people to take home from your comments is the local nature of this pandemic. National data is interesting, but what you care about is where you live. And so we are really urging you, based on what Dr. McIver just said, to check with your local health department and find out what the case transmission rate is. Dr. Crawford, I want to get you in, Eric, Dr. Griggs, I want to get you in on this as well, and thinking about sort of what's happening with communities of color, elderly. Are there special populations that should be particularly concerned?
Actually, yes. We don't want to be left in the dark with this. No pun intended. The elderly patients and patients that have conditions, immune compromised. Oh my goodness. So you wanted it from the community. I give it to you from the community.
Go right ahead. You keep going.
Yeah, it's the people that are immune compromised or patients that are over 65. It's now, as we know, COVID-19 has become more and more prevalent in our population. I mean, everyone at this point has either had some version of the virus or knows someone that has. We're moving into the holiday season. I like to put it that way rather than call it our winter respiratory season. Let's keep it up and keep it positive. So it's imperative that for those that we want to protect, while we're loving on them during our holiday season, with our elderly and our kids, that we get vaccinated and get boosted. Whew.
Outstanding. Very important. And anyone that's ever done live TV knows these little glitches occur, but they don't deter us from listening carefully to the information. The one thing I also, as we start to turn now to the vaccine, I want people also to realize that somewhere between 400 and 500 people every day are dying from COVID in this country. This is by far not over. So that's why it is so important that we are able now to start to understand about these vaccines. And to help us to understand about the new bivalent vaccine, let's turn to Dr. Keith Crawford first. And Dr. Crawford, help us to understand what the new vaccine is, why it's different, and why it's so important that we get it.
So first of all, thank you so much again for having me participate with these outstanding panelists. And I'll just put out here that my comments are my own personal comments based on my professional expertise and experience, and not the view of the National Institutes of Health or the official word. But what is really amazing here are these, what we call mRNA vaccines. These are phenomenal vaccines. This is the first time these vaccines have been used. It's a new technology. And one of the individuals who was instrumental in developing this approach Dr. Mrna Corbett, who is a colleague of mine at the National Institutes of Health, although I didn't know her, we did communicate some. She was one of the key developers. And what this vaccine allows us to do is to very easily change the type of vaccine that is produced to basically correspond with the most prevalent variants that are out here. So now you probably say, well, we came out with a version of the vaccine which was actually designed against the original virus, which we call the Wuhan virus from Wuhan, China. That's how that was developed. But we've had so many different variants, so many genetic mutations that have changed the virus. And basically, this virus is evolving, it's changing to escape our immune system, to become more infectious, and to also escape the protection from the vaccines. So why did it take us so long to come up with this bivalent form? Because we kept getting changes. The virus kept mutating. So this new version has a combination of the Omicron, carries some of the mutations of the Omicron captured in its genetic material, and some of the original virus captured in its material. So it's a mixture of different types of strains. And so this allows our immune system to see a more diverse range of targets that we can develop antibodies against, and that our body can generate an immune response to. So this combination kind of makes it stronger. It's a strategy that we use in some of the other vaccines. We're going to talk about pneumococcal vaccine. We have mixtures because these are organisms, and there are multiple, you might think of variants or species, and sometimes it's important to capture that diversity so we can protect ourselves better. I hope that helps.
Well, thank you so much for that. And I'm glad that you mentioned the name of Dr. Mrna Corbett, but I'm also glad that we have you on the call, because so many people in the African-American community have been concerned about whether or not people of color are in the decision-making process for approval of these vaccines. And so to see you here on our screen makes us understand that there are people from our community who care about our community, who are inside the decision-making process. And so we thank you for saying that. Dr. Frazier, you have been, and your company, instrumental, obviously, in making these vaccines. Tell us about what we can understand about what excites you about it, and also something about why we can be confident that this new form of the vaccine is going to not only be very effective in working, but also safe for people to take.
Well, thank you so much. And I want to capitalize a little bit on something that Dr. Crawford mentioned, and that was about the Messenger RNA technology. So one of the things I think to make people feel a little bit better about this technology is that it has been 2 decades in the making. So for 2 decades, we've been studying messenger RNA technology as a vaccine, as well as for certain cancer therapies. So that part's not new. The other thing I think that's important to note, because I know people were very concerned about the rapidity of how this vaccine was brought to market. If you think about vaccine development and really medicinal development in general, there are definitely different phases, and those phases are typically done sequentially. But there isn't time to do something sequentially in a pandemic. You don't have years and years to come up with a solution while people are dying. So what we did was do everything concurrently. So all of the phases were done at the same time. Nothing was left out. There were no corners cut. And so if you typically look at vaccine development having 30 to 60,000 subjects over a number of years, we had 44,000 subjects in our study. So right squarely in the middle. We took a look at many, many subjects, and we collected a great deal of safety data, which we continue to do. I think the other thing that should make people feel comfortable is that the government has a number of different ways to collect vaccine adverse event responses. And so that data is being tracked on a constant basis, both within our company and Moderna, and at the level of the CDC and the FDA. So I think all of that should make people feel a bit better. With respect to the new bivalent vaccine, half of the vaccine is made up of the original ancestral strain that Dr. Crawford mentioned. The other is a half of B4, which is one component or one subvariant of the Omicron family, and BA5. Those are the two that seem to be most widely circulating in the country currently. We have a great amount of data currently that shows wonderful immunologic responses to this vaccine, similar to the previous vaccine. And one additional comment that I would make is I think at times we have forgotten what the words herd immunity mean. And we're trying to use the words herd immunity when we talk about this disease state. With this virus so rapidly varying and mutating, that concept is a little bit out the window currently. So vaccination is the best way to help you and your family and community.
Right. Well, thank you so much. And one of the frustrations that I know people have is why are we always having to have these new vaccines? Because we have these new variants. And the reason we have the new variants is because we unfortunately had too many people in our population who didn't get vaccinated on the front end and allowed this virus to hang around and then change. And so if you're frustrated, don't be frustrated at the public health people, be frustrated at the people that didn't get immunized so that this doggone thing could hang around. It's important that people know where to go to get these vaccine shots. And I'm glad that we have Dr. John here from Walgreens. Charlie, give us a sense of where we can go and to be able to receive our vaccine. And does it cost any money?
Yeah, that's the big question. So I'd like to say thank you for having me join here. I'm honored to be amongst this esteemed panel of experts and true public health champions, everything that you're doing to help this country get out of this pandemic. And just a huge thank you to everyone who's tuned in. This signifies that you're taking this topic very seriously. You're taking your healthcare very seriously. And the topic we're talking about is a great way to be on a forward footing there. In terms of getting the vaccine, there's plenty of options for folks to find those. You did allude to, early on in the pandemic, we had lots of sites like mass vaccination clinics and other clinics that way. Most of those have come down, but what is available are many, many different provider sites. You have your local provider sites, you have your community health sites, you have county clinics and things like that. And what I'm here to speak on behalf of is the 50,000 network of pharmacies that are across the country. There's a stat that 90% of the Americans live within 5 miles of community pharmacy. So we've been called upon to really mobilize and be a great access points for folks. And so we encourage folks to come in and get their vaccine. In most cases, walk-ins are fine. We do recommend folks to schedule an appointment. And you'll see our vaccine scheduler website scroll across the bottom. That is the best way just to ensure that as we're in a season of a lot of COVID vaccines and we're doing a lot of flu vaccines, it will provide for the most seamless experience for you and your family. So we encourage folks to do that. It's so important now to get vaccinated, to get up to date on your vaccines, as the CDC recommends, to also get your flu shot. Dr. MacGyver, when she was discussing what the current trends are, the case counts that she alluded to, the hospitalizations that she mentioned, the deaths that you mentioned, those have all declined from the previous week, and they've declined from the weeks before. And I think that sometimes tends to make us a little complacent with what's going on, and we feel that everything is okay. But Dr. Tuckson, you just mentioned it. If we have case counts this high, 50,000 a day, it allows for this virus to keep going and to keep changing and to vary as all the folks have mentioned. And then it could potentially lead to that hospitalization case where who knows, anything can happen, anything could go wrong, and then you're in that situation. And then, of course, you mentioned it, 400 deaths a day. That's unacceptable when we have a tool in our toolbox like these wonderful vaccines that can really prevent this disease from occurring, and even if it were to occur, to really limit the damage that it can do. So just a huge call to everyone to go out and find your vaccine.
Exactly.
Could I add another
by the way,
comment,
Dr. Frazier,
Dr.
yes, go ahead.
Yeah, so one of the things I can understand early on reluctance in African American or Latinx or indigenous communities for these vaccines. I can understand that. We have now had millions of doses, tens of millions of doses. We know these vaccines are safe. And even though these variants may not have the same level, we may not get the same level of protection from the vaccine, they still continue to work. They still protect against hospitalizations, across death. These vaccines have really proven themselves. And the hope, of course, is the new bivalent vaccine will be even more effective. But this is the best defense against this deadly disease by and
thank
far.
you. Thank you so much. And we only have a couple minutes left in this section, but let me ask Dr. Frazier, if you would please, from your point of view, are we going to have a new vaccine every year? When does this end?
Well, that's the million-dollar question, I think. And so we don't really know the answer at this point. We are planning for the possibility that this will require a yearly vaccination similar to the flu, because the flu is changeable, of course, from year to year. And this is a changeable circumstance, a situation as well. It does appear to be growing endemic. And when a virus becomes endemic, then it requires continued campaigns. So for now, I can say it's anyone's best guess. It's looking like that, but we don't know the answer to that at this point.
Great. And would you also,
Dr. Tuxen, if I could.
Yes, Charlie. Yes.
Sorry, I had failed to answer your second question to me earlier. I just want to ensure that everyone knows that. So the U.S. government has procured all the vaccines so that there's enough for all Americans for their complete series of vaccines. So do know that should not serve as a barrier. The cost for these vaccines are covered. So please come and get your free vaccine.
And you can get that at the great stores that you operate in your company. You can get it through your public health department, has special clinics in most public health departments around the country. And then many physicians and hospitals also do it. So really no excuse. And by the way, the holidays are coming. You want to be able to have Thanksgiving with grandma and grandpa and not kill grandma and grandpa. So get your dose now, get it early, and make sure grandma and grandpa got their doses early so that it'll be working maximally in only a very short period of time before we get there. Well, thank you so much. Dr. Frazier, if you would put in the chat, please, the answer to the question of who is eligible to get the vaccine, and whether or not you have to wait after your last booster shot or after you recover from having had a recent bout. I know that you know that, and we can just let you type that into the chat, because we're going to move to another important issue. And it's an issue that I don't think a lot of us think about, and that's the pneumonia vaccine. I, as an internist practicing internal medicine earlier in my career, would be so sad to see our people dying of pneumonia. It is a terrible disease, and it's a terrible way to die. So, Dr. McIver, can you help us to understand what is pneumonia, how does it affect the body, and what are some of the causes of it?
Sure. So I'll start in simplest terms and say that pneumonia is an infection of the lungs that can cause mild to severe illness in people of all ages. And vaccines, which are covered by Medicare or in healthcare.gov, and most health insurance plans, can prevent some types of pneumonia. You can also help prevent pneumonia and other respiratory infections by following good hygiene practices. So, we want to continue to have people still wash their hands, cover their coughs, things of that nature. But more importantly, we're encouraging individuals to talk to their providers about getting up to date on all their vaccines. But this one in particular is covered, and is something that we think about annually. And also, I guess I'll flag here that if you are a provider or community organization looking to get information on prevention and covered services and how to use healthcare coverage, you can visit our Coverage to Care from CMS Office of Minority Health and find resources to assist at go.cms.gov/C2C. So as you said, this is something that we must talk about annually. And there are concerns that this could be a severe year related to pneumonia. So we're encouraging people to talk to their healthcare providers about, what is available for them.
Thank you so much. Dr. Crawford, one of the things that I think you started to mention earlier, and as we talk about this pneumonia vaccine, is a sense that sometimes we get people who are concerned, wow, there are an awful lot of shots that we have to give. And it's almost presented as if that was a problem. Can you talk about why things like the pneumonia vaccine really represent enormous breakthroughs for the possibility of human health that are very easy to achieve and without any concerns around safety? Oh, Eric, Keith, you need to put your off mute. Good.
My apology. So we like to say that an ounce of prevention is worth a pound of cure. And when we think of infections like the pneumococcal infections that can cause life-threatening pneumonia, other organisms, influenza, the best protection is to keep from getting the infection to begin with. What we have done over the years, because in the case of the strep pneumonia, the pneumococcal organism has a number of different strains. You can kind of almost think of it like the coronavirus is changing different forms. There are different forms of the pneumococcal organism, and we have to try to capture as many of them as we can. So we design these vaccines. We say we use a term polyvalent, which means this is a vaccine that can target multiple different strains. We say the same thing about like a human papillomavirus vaccine. They're polyvalent because they're oftentimes different strains or different forms of the organism. And if we can combine into the vaccines, now this can be more complicated to try to cover a variety of different strains of the same organism. But that's what we try to do because that can provide maximum protection. Now, many of these infections, we do have drugs that we can use to treat them. But in the case of some of these organisms, they become resistant to some of the drugs. They become resistant to the antibiotics, which means we may have to use more expensive or more toxic antibiotics to fight the infection. So it's better if we can get vaccinated and just not get the infection at all and not have to go down that path.
Well, Dr. Griggs, you spend a lot of time talking to people in the community, and how do you talk about this issue that we've just explored around those people that are so concerned that they have to get so many different shots? But also, as you talk to them, where do you tell them to go to get the pneumonia vaccine?
So I'll start with the last part first. Of course, I tell them to talk to their primary care provider. That's the best place to have the conversations. And prior to this situation that we're in with the pandemic, we were some of the most trusted individuals in a person's life was your healthcare provider and those that provide information. So I'd start there. What I tend to tell people is by the time you're old enough to realize that you'd ever taken a shot when you were born, you've taken more shots and been immunized more times than you can imagine. As we learn more on how to protect ourselves and to keep living, there will be more immunizations as new things new things come into our species and we learn how to protect ourselves from old things, it might be a shot. It could be a pill. It's not necessarily with children and infants. It's not necessarily a shot. It's like the oral vaccines that used to be around. I mean, there's a lot of things that we do to protect ourselves, and in order to keep living and enjoy the way that we're progressing, you have to give us a little bit of grace and give yourself grace and understand that this is not punishment. This is all for protection.
I love that answer. That is a great answer, and it always perplexes me, Dr. Griggs, and you, Dr. John. As I come to you in a moment, it always perplexes me when people, sort of criticize having to go get the shot. When you sort of say, "Well, what would you rather, have the shot or die, or get terribly ill?" I mean, it's like science has given us the opportunity to save ourselves from things that have killed human beings for centuries. And now we are sophisticated enough as a society to have vaccines that can keep the things that used to kill human beings very early in their life. And now we can live into our 90s and some into our hundreds because of the science. But Dr. John, I'm curious about what you tell us about where we can go to get the pneumococcal vaccine.
Sure. No, thank you for that question. And my answers may sound similar in all three sections, but I'll add on to how Dr. Griggs characterized the relationship with the healthcare provider, because pharmacists are right up there as one of the most trusted health professionals. I spent 10 years in practice, and I so vividly and fondly remember all my interactions with patients. Immunizations are probably the beyond dispensing of medications for folks' chronic diseases or acute diseases. Immunizations are becoming what pharmacists are probably most recognized for. So these interactions where we have an opportunity to provide information and education and help people be aware of their vaccination status is really high on our list. Of course, many of our pharmacies are open extended hours through the evenings and on the weekends. There's been research that's shown in past flu seasons, almost a third of all the vaccines that were administered, and we're talking tens of millions of vaccines administered, were done off hours, in those evening hours or in the weekend hours. So it's to really bolster the access point. Pharmacies are really good at that. And so our scheduler page, again, is listed on the scroller. So folks can go on there to try to schedule an appointment. And of course they can walk in and do that as well.
Yeah, let me interrupt you there. Let me interrupt you there, Charlie, because one of the things that I know that many of us are timid people and can be intimidated by the busy pharmacist behind the counter. But if you go into the pharmacy and you've got a cold, or you feel like you got a cold, you got the sniffles, and you go to buy something, if you're concerned that might be more than something, or that becomes the moment that you decide to get the vaccine, are you able to go up and have a conversation, or do you have to schedule that with I know they can be busy, but do we need to be intimidated to be able to have and be afraid to ask questions?
Absolutely not. That is exactly what your community pharmacist is there for. It's really sometimes it's the gateway to healthcare for many folks. Folks come in never having sought a provider before. Perhaps they don't even have a primary care provider, but there is going to be a community pharmacist likely within 5 miles of them. And this is where they can come and get trusted information and really be set on their healthcare journey. A lot of times we can provide a service right then and there. You mentioned the person who's maybe acutely sick at that time. That might not be the right time for their vaccine, but there's opportunities for us to set that up. And then a lot of times what we do is to make referrals when there are situations that require more complexity, to refer folks to Dr. Griggs when they need to have a deeper look into what's going on. And that's, I feel, how this group, which I would term the immunization neighborhood, it's a group of practitioners and providers really working together, really sharing best practices, increasing awareness, all in the effort to vaccinate as many people as possible.
Wow. And by the way, do you have to pay money to get the pneumococcal vaccine, or is that covered by insurance?
It is covered. So it is covered for all folks in Medicare. It is covered for folks in Medicaid, and it's covered for folks that have commercial insurance.
Well, that's terrific. Well, we're getting ready to shift, and I'm going to bring in Dr. Frazier for a minute because she's a neurologist, and we're going to be talking about shingles for a minute. And And I think that it would be very useful to get a perspective from Dr. Frazier on, you obviously you see these patients in your clinical practice for sure. Can you just give us a little background on what that is and what it's like to get it?
And thank you so much for that question. So I think some people don't recognize that 1 in 3 adults will develop shingles. That's a very high odds, 1 in 3. And I can tell you about a patient that I saw just 2 weeks ago, and I am seeing her now for something called post-herpetic neuralgia. So she had shingles, the lesions resolved, but now she's left with this horrific neurologic pain. And that's what we're working with. But in addition to that, she had it on her face and it went into her eye. And so she has partially lost vision in that eye. She's partially blind. So shingles is a very, very important thing. It's a vaccination that is recommended for individual adults 50 and over, all adults 50 and over. And I can only encourage that most strongly, just because your odds of 1 in 3 are quite high. All of us have probably been exposed to chickenpox. Not all of us have had symptoms, but we may have all been exposed. And we may all have that virus residing in our nerves, just waiting for the opportunity to manifest as shingles.
Wow. And let me just turn to to Dr. Crawford, who understands these vaccines very well. I think we have to have is it 2 doses now of the shingles vaccine?
Yes.
And talk a little bit about, just in terms of understanding again, what we need to know about that vaccine.
So it's 2 doses. As Dr. Frazier spelled out very clearly, you've likely already been exposed to the virus. These viruses in this particular family seem to have the ability to hide out in places of the body, and they like to hide out in like nervous tissue. And as Dr. Frazier pointed out, these lesions, very painful, appear, and even after it's resolved, it's still a lot of pain. She described this syndrome, the post-herpetic neuralgia, which is just this pain that follows the type of infection. So what you want to do is get the 2 doses. It's 2 doses required for this vaccine. This is the case for a number of vaccines, that there may be more than one vaccine, the coronavirus vaccines, and then the boosters. And you're like, okay, well, what's up with all this booster and second dose and all of this? Because this is designed to maximize, your body's protection if in case you get exposed to a virus or bacteria, whatever the organism is. So again, after 50, because in general, as a general phenomenon, as we get older, our immune system, just like other parts of the body, just don't seem to function as well. And so this is the opportunity where our weakening immune system could allow, and I'm not saying weakening as if there's some disease, just the ordinary age-related decline could allow this shingles virus to just come out of hiding and wreak havoc. So as Dr. Frazier pointed out, after 50, we recommend getting the vaccination. And for people who have not gotten the vaccination and had shingles, they very much wish they would have gotten.
It's one of the most painful disorders that just putting on your shirt gives exquisite pain. It's really something that you want to avoid. Before we go on, though, Dr. Crawford, now that I have you on this, we have said for the COVID virus that it is very good. I think it was Dr. Frazier that mentioned it, is that that the virus is very skilled at changing its shape, its structure, and avoiding the army of defenses that either come from immunity or from a virus. Now we're talking about the shingles, which hides inside of the nervous tissue for years and years and years, and then suddenly decides to erupt. We as human beings are living in a very complicated world, aren't we?
We certainly are. Case in point, the monkeypox virus. I think what people need to understand in this case, monkeypox is not a new virus. This is not something that just popped up out of nowhere. I mean, you might be able to argue that the SARS-CoV-2 is a new or novel virus. This monkeypox is not. And so now, and I think we need to talk about this because this is an infection that we commonly encounter in Central Africa, West Africa. This has been going on for several decades. We have drugs that we think are effective. In fact, my division, we're in the Division of AIDS at NIH. We have a clinical trial trying to validate the effectiveness of a treatment that we have, tecovirimat. We have a vaccine. Well, we have a vaccine. We have a treatment. The people in the Democratic Republic of the Congo, where one of these strains originates from, the people from West Africa, where this current strain originates from, they don't have access to these vaccines or these treatments. And so we really have to stop this pattern of only being concerned about pathogens when they emerge in the US or Canada or Europe. It was only a matter of time before monkeypox was going to emerge. Now, thankfully, we had some drugs. Again, these were studied against smallpox, but they work on monkeypox because they're similar viruses. It's a similar situation for actually COVID-2, SARS coronavirus. Some of the drugs that we actually, the first drug that we got approved was not a new drug. It's a drug that had been studied for Ebola, and this is the drug remdesivir. The first drug that was given an authorization for treating a coronavirus infection. This was not a new drug, but one we had studied previously. But again, we weren't interested in Ebola until we started getting cases of Ebola coming to the U.S. So I think in this global community that we live on, I've done a lot of work in Africa, and you can get over there very quickly. You can get to any corner of the globe in hours. People move all over. So we need to stop looking at whether a disease or a pathogen affects us, whether we're at risk, before we think about whether we should intervene.
Great point. And by the way, that point also argues, doesn't it, for we in the United States, people of color, we need to be advocating for our brothers and sisters on the continent and other places in the world as well, because it's so unfair that we have these things to save our lives and they don't. And by the way, it's also very sad that we don't take advantage of the things we have enough. And there are other people in the world who are just begging for what we have. I want to just ask a quick question on this section to Dr. John, and then I'm going to turn to you, Dr. McIver, in a minute, because I'm very curious about some of the challenges that you're facing in your job. You have one of the most important jobs in the country, and I want to go to you in just a minute. But Dr. John, do you have to have a prescription to get the shingles vaccine?
You do not. You can come into any of our pharmacies. You can schedule an appointment and you can get that completed. And I'll even add a point about cost because it's an interesting quirk from the previous two sections. We just had a momentous policy change that now makes the shingles vaccine at no cost for Medicare beneficiaries, for seniors. Before, it was common for the copays for a shingles vaccine to be somewhere between $70 to $100. And we have research that shows that when copays are at that level, folks are 6 times more likely to walk away from that vaccine. So a momentous policy change that will now make the product at no cost for seniors, and that last barrier kind of knocked down.
Wow. One of the things that we may have to, by the way, do a show on at some point is there's a very important legal case in front of the Supreme Court, and the Congress, especially the Republicans in the Congress, are going to be making this issue difficult, and that is to try as one more step to dismantle the Affordable Care Act. They're going to try to dismantle the free preventive services that are part of the Affordable Care Act. And it's our people that are going to suffer so greatly by that. And so we need to be very attentive to what's coming out of the Supreme Court and what's going on in the Congress. Dr. McIver, you are you are responsible for the minority health agenda at the largest health insurance company in the world, probably. You are Medicare and Medicaid, and you are the Office of Minority Health. You have to think an awful lot about the challenges of trying to help get people to make personally appropriate choices and decisions. What are the biggest hurdles that you are up against in your job? And what do you say to this audience about how we need to overcome some of those
Well, we have a lot of work ahead. I think, we have experienced fatigue from the pandemic. And as you said, our office is the Office of Minority Health. We know that racial and ethnic minority populations were disproportionately impacted in many ways by the pandemic. And as I think about current challenges, we are, there's the issue of data, right? Like, what do we know? Where are the data sources? How do we strengthen the data that we have so we can better meet the needs of underserved populations? Making sure that the information that we're putting out relating to health insurance is accessible to people. We have a health insurance literacy program that helps people understand their coverage. And actually, this is a great segue into something that I want to make sure I share before the end of the program today, which deals with the open enrollment periods that are coming. So as you mentioned, CMS is the largest health insurer in the United States. And we cut our programs include Medicare, Medicaid, and CHIP, which is the Children's Health Insurance Program, and the Marketplace plan. So what you can find through healthcare.gov. So there's 2 important dates that I want to share with your audience, because one of the common threads of the conversation today is accessing care and making sure that people know that there are resources available and potential plans for them. So first, I'll start with Medicare. Medicare open enrollment period starts this month. It starts October 15th through December 7th. And it is the one time each year when more than 64 million people with Medicare can review their health coverage and make changes. So we're encouraging people with Medicare to compare their health and prescription plan, drug plans, to make sure they have the best plan that meets their needs. The other thing I want to mention, or the other important date, is November 1st. So next, the marketplaces, or some people say healthcare.gov, as of November 1st, the marketplace open enrollment begins, and consumers can go to healthcare.gov to update their information or add it for the first time and select a plan that best meets their needs. Consumers may even qualify for financial help paying their health insurance premiums. And we encourage people, even if you have health insurance through the marketplace, to be sure to update your information and always apply for financial assistance in case you may qualify. So again, those 2 important dates to remember is the open enrollment period for Medicare, which starts October 15th through December 7th, and the marketplace, or healthcare.gov, the enrollment period starts November 1st.
Great. Well, thank you for that information. And let me turn to Eric as well on the same kind of question. You're out there. We may have lost Eric. Do we still have him? Well, if we don't, let's move on. And I wanted to come back to Dr. Frazier and ask you about one of the concerns that our audience has is whether or not you can take these vaccines at the same time. How it seems almost overwhelming that we've talked today about 3 particular vaccines, and in fact we talked about 4, and because we also mentioned the flu, and we're not going to, ladies and gentlemen in the audience, forget to tell you, to beg you, please get your flu vaccine, and you want to start getting that right about now. Certainly towards the middle of this month, so that it will last all through the winter. And we don't want you to get the flu in the middle of everything else. And I'll tell you, the people that work in our hospitals really don't want you to be clogging up the emergency rooms with a lot of flu cases at the same time. We're going to be going through, most likely, from what we can tell from the events in the United Kingdom and in England, that we're probably getting ready to go through another winter surge of COVID. So you don't want to have the surge in the winter of COVID combined with getting a lot of flu. That's just not fair to you, and it's definitely not fair to the beautiful men and women who are trying to serve us in our hospitals. But Dr. Frazier, how do we come to understand whether we can take some of these at the same time, or do we have to space them out? And where do we go for the information to learn about it?
Well, and that's an excellent question. So as an advisory committee to the CDC is called the ACIP. They're the Advisory Committee on Immunization Practices. They do have a website. CDC.gov has a website as well, and it tells you all of the very up-to-date information directed toward both healthcare providers as well as patients themselves. As of today, we also make a pneumococcal vaccination. As of today, we received our label change so that you can give a pneumococcal vaccination at the same time as the flu. We had given them our data on that in this last month. In addition, the CDC has decided that you can have the COVID vaccine and the flu vaccine at the same time. So yes, in fact, you can have COVID, flu, and the pneumonia shots all at the same time. What we do suggest is that you have it at different sites on your arm, not all in the same location. But yes, the CDC has said that all the vaccines can be combined in one visit.
Great. And I really hope that people will pay attention to that website, cdc.gov. I'm going to tell you, that is the single best place to go for what you need to know about making these personally appropriate choices and decisions. And so I would really urge everyone, if you have a question, because this is complicated, but it's also simple. And so just go to cdc.gov and put in the little question or search function the question you have, and they'll pretty good at being able then to respond. Well, as we start to think about closing out this conversation, and I'm going to start with Eric Griggs. We lost you for a moment there, but what I was going to ask you to talk about a little bit were the challenges that you're facing in talking to the community where you're working down in Louisiana about trying to comply with some of this guidance that we are giving, and what do you say to the audience? But as you answer that briefly, I'm just going to warn the panelists that I'm going to come to you with a lightning round. I want to make sure that our audience gets everything you've got. And so in about a 30-second spot, I want each of you to say either whatever you have said that you want to double down on to make sure that everybody heard you, or the one thing that you wish you had said that now will be your opportunity to say it. But as I do that, Eric, you get the first crack.
So here's the thing. As we know, as hopefully I've demonstrated, the only thing constant is change, and we have to be able to live in the pivot. And there's no other reason than to be able to adapt than to keep living. I know that we're tired, but it's better to be tired than not be here. Science is here and has been here and is here to help further our species and to help us along. Remember, I said it's not punishment, it's protection. So what I constantly tell people is I can tell you something now to help you prevent getting ill, or we can come talk after you get ill and talk about where you need to go to get treated. The choice is yours, but it's always happier on the prevention side.
Perfect. And now, Meg Frazier, the lightning round begins with you. Uh-oh, Meg is frozen. We'll come back. We will start with Dr. John.
Great. Maybe I'm doubling down, but I would just encourage everyone, come see your pharmacist, come see that expert resource that's in your backyard, and learn from them and get educated about vaccines. I just want to encourage everyone to really be up to date on their vaccines. You know, vaccines are the best deal that we have. It's a simple intervention that can make such a difference. You described how painful and traumatic shingles can be. Why do we want to go through that? And then just think about all the costs that our healthcare system has to go through. It's estimated from the vaccines that we're talking about, they cost the healthcare system about $30 billion annually. And these are from vaccine preventable diseases. So go out there and get your vaccine. These are things that are reviewed by expert agencies such as the FDA and CDC. They have decades of experience. As Dr. Crawford mentioned, 600 million plus doses of COVID vaccines have been administered. We know about this. These are safe. They are effective. Let's all go get vaccinated and save each other.
Dr. McIver.
Well, I'll just, go back to what I said earlier. Coverage is something that is important in this equation. And I'm excited to share that starting October 15th through December 7th, Medicare's open enrollment period begins. So please, make sure that if you have Medicare, that you go to our website and update your information. In addition, the other important date that I mentioned is November 1st. So a few weeks away, we're right behind the open enrollment start for Medicare. You can go to healthcare.gov for the open enrollment period for the marketplace plans. And I'll just echo what my excellent panelists said today about, just take advantage of this conversation to do what you can to protect yourself in your community. And Dr. Tuckson, you said at the beginning about the numbers I shared. The numbers are numbers, but it's local. It's in your home, your community. So encourage others to listen to this today to get information, but most importantly, to take advantage of opportunities to get vaccinated during this critical time of the year.
Outstanding. Meg Fraser, you doubling down or adding something new? Oh, Meg is still unfrozen. Eric, you doubling? Did we get Eric? We got you already. Dr. Crawford, doubling down or something new? Take off mute.
Sorry, something new. So echoing everything that my wonderful colleagues said, vaccines are the best protection. However, as COVID has shown us that this virus can sometimes reinfect or infect a person who is vaccinated. We know that there are vaccine breakthroughs. We have another tool. We have treatments. I talked about a drug, remdesivir, but remdesivir has to be given intravenously, and that creates a sort of a problem. We have an oral treatment. We have a drug, Paxlovid, which can be given from your pharmacy if you get a prescription from your provider. If you cannot get a prescription, you don't have a provider, or you are not feeling well and it's the weekend, you can't reach your provider, you can go to, guess where? The pharmacy. The pharmacy can test you. They can actually dispense Paxlovid for you if you have symptoms. The key thing to remember, if you have symptoms, if you're in a high-risk group, you're older, you're over 60 years old, you have diabetes, obesity, chronic pulmonary diseases, you can get the intervention, get the treatment, the Paxlovid. You have about 5 days. You have a narrow window after the symptoms to get the treatment, and it's very effective.
We'll leave it there. We'll have to leave it there, but let me just say to you, Keith, and Dr. Crawford and Dr. McIver and Dr. John and Dr. Griggs and Dr. Frazier, thank you all so much. And we also want to thank our sponsors. Really appreciate what CMS has done to help this to happen. Pfizer, thank you for your help. Walgreens, thank you for help. But above all, thank you to Bio. We really appreciate your leadership on this and your help to us. Everyone, have a good time. Get vaccinated. Stay safe. And above all, be healthy for yourself, for your family, and for our community. Take care. Bye-bye.
Thank you, everybody.